Hello everyone, my name is Mengzhou Chen. Today I'm presenting my poster on prolonged standing in the operating room, which is supervised by Hamada Sadi, Dr. Dimitrios Stefanidis, and Dr. Danny Yu. Starting with a bit of a background, prolonged standing is commonly required in many jobs, but surgeons have especially suffered from health issues associated with it, such as lower back pain, varicose veins, and high blood pressure. Studies have shown that a lack of dynamic movement for even just 30 minutes can lead to discomfort, while the average surgery time is about 3 hours. Some current interventions to mitigate the adverse health effects include intermittent seating, changing shoes or floor conditions, and adjusting postures. Moving on to the methods, this begins with data collection in the operating rooms. We collected pre- and post-discomfort surveys from surgeons, and data was collected using a pressure mat, where surgeons stood on during surgeries, which you can see in Figure 2. About 30 surgeons participated, and 24 exposures were converted and processed by the MATLAB algorithm. Visual outputs were produced, including raw mat images, images with grid lines, and images with right and left labels on the feet. The majority of the work that I have done is in data analysis, where 16 exposures were analyzed, errors were identified and classified, and the outputs were either adjusted or excluded to increase the accuracy for each exposure, which I will go into more details later. The data was rerun, and the outputs were rechecked until we reached the optimal levels of accuracy. Standing-related metrics were calculated, such as the frequency of the body weight shift. In the end, we will conclude on the differences in the standing patterns between attending and assisting surgeons, and implications will be made on job-specific interventions for the surgeons. Moving on to the data analysis, our goal is to identify the right and left feet accurately with a minimal amount of errors. We manually check the errors in each frame of the outputs. We start with identifying the surgeons and making sure they are present on the mat. Here's an example in Figure 3a, where both surgeons were on the mat, standing towards the patient bed, with the attending surgeon on the left and assisting surgeon on the right. Next, as you can see in Figure 3b, the boxes were defined to confine the surgeon's feet with the appropriate dimensions and positions, and the accuracy of the boxes were checked. Moving inside the boxes, we identify surgeon's feet. In Figure 3c, the right foot is labeled with R and the left foot is labeled with L. The accuracy of the labels were also checked. For each exposure, accuracy was calculated to determine if the outputs need to be adjusted, and we rerun the algorithms to adjust the outputs. Outputs were rechecked to recalculate and improve the accuracy. Lastly, standing-related metrics such as shifts were calculated. In Figure 3d, the normalized forces of the surgeon's feet were changing over time, which were used to compute the number of shifts. After analyzing each exposure for the surgeon, we have calculated the percent over the mat and two standing-related metrics as results for each surgeon, including frequency of shifts and average shifts per minute. In Figure 4, here's the visual representation of the results of an assisting surgeon. The surgeon was standing over the mat for 82% of the operation time, with 326 shifts. The surgeon had 1.6 shifts per minute for the first 10% of the time, while the surgeon shifted more frequently with 5.5 shifts per minute at the last 10%. Based on the results for each surgeon, we summarized the 16 exposures in Table 1, where on average the assisting surgeons stood on the mat 12.5% more of the time than attending surgeons. In addition, the assisting surgeons had 2.5 less shifts per minute and 344.3 less shifts per exposure than attending surgeons did on average. Based on our preliminary results, we were able to identify two standing-related metrics, which are the frequency of shifts and average shifts per minute, that will help us to monitor the discomfort levels and related health impacts for surgeons. Shifts tend to be more frequent over time, and surgeons shifted more frequently on the mat when they are fatigued. As we do further analysis, we are going to examine other standing metrics, including frequency of other postural changes, center of pressure, and body sway. The differences in unconstrained standing patterns between attending and assisting surgeons will be characterized. We will also work on employing job-specific interventions to reduce surgeons' discomfort. Thank you for listening to my presentation.